My name is Sarah Smith. I am performing the med administration via minibag. So first what I'm going to do, I'm going to go ahead and do my hand hygiene here while I prep all my meds. I'm going to check the MAR for my order, which is vancomycin 200 milligrams over 2 hours at 10 drops per ml. So I'm going to go ahead and check my expiration date. That's good. It looks like this is 100 milligrams per ml. So for the vancomycin, we're going to look at our lab values first. The BUN, the creatinine levels, the CBC. You're going to look at the white blood cells, red blood cells, and everything. Make sure everything is within normal limits. Vancomycin, the action of the med is it binds to the cell wall, causing cell death. The purpose, it's used to treat life-threatening infections when less toxic anti-infectious are contraindicated. The recommended dose for an adult is 500 milligrams every 6 hours, and the side effects you see with this is ototoxicity, hypotension, red man syndrome with rapid infusion. The contraindications are hypersensitivity to the med and renal impairment. So the nursing implications for this med would be to assess the vital signs, assess the infection, monitor the IV site for infiltration, and monitor blood pressure. And you'd also want to watch for the red man syndrome. Okay, so what we have our vancomycin. I'm going to go ahead and attach my needle here. Since I'm pulling up 2 mLs for 200 milligrams. Here's my mini bag. I'm just going to go ahead and insert this to the mini bag. My 2 mLs. And I would dispose of this in my sharps container. Mix that up, and then I want to date and initial the dose, the amount, the frequency on my label on my mini bag. Then I would get my tubing, have that prepared. I'd go ahead and label my tubing for the date and the time, my initials, so that the next person knows when this needs to be changed. I'm going to go ahead and spike my bag. And the tubing is clamped. Get everything ready. And I'm going to unclamp it and prime it. And I'll wait and see if the fluids run all the way through the tubing. And they are. I can feel it in my hand. Okay, so my tubing is primed. I'm going to go ahead and go into the patient's room. I'm going to grab my flush, my gloves, and my MAR. Okay. I would knock on the door. Hello, my name is Sarah. I'm your nurse today. I'm here to give you your vancomycin, which is your antibiotic. Do you have your name and date of birth for me? Okay. Do you have any allergies? No. Okay. Very good. So I've already primed my tubing, so I'm just going to let that hang right here for a minute because I want to check my IV site. I'm going to wash my hands and put my gloves on. want to check my IV site. Do you feel any tenderness here? No? Okay, I don't see any redness or swelling. I'm going to go ahead and flush the IV. So I'm going to clean the hub. Attach my pre-filled saline syringe. Unclamp the IV. Aspirate. Good blood return. And now flush. Push, stop. Push, stop. Very good. And I'll clamp my IV tubing. Okay. Now I have my tubing here. I'm going to take the top off. Good. And I will clean my hub again just in case. Alright. Connect that. I will unclamp my tubing here. And I will adjust this to set my flow rate at 4 drops per minute. Okay? So that's going. I will check the site, see any redness or swelling. I would ask the patient, do you feel any pain with this? Is everything okay? Alright. And I will go ahead and check for the 4 P's. Do you need to go to the bathroom? Do you have any pain? Is your position okay? And do you need any personal belongings? And then I would make sure the bed's in the lowest position, and come back and assess the site after 2 hours when the antibiotic is finished. I would go ahead and take my gloves off, and I would document the med that was given, the dose, the route, the frequency. I would document any patient teaching that I did, the patient's response to the med, and that's it. So I would take my gloves off and wash my hands and come back later. So when I come back, I will wash my hands, re-glove.